Thank you. So my name is Minja Salmio. I'm from Nightingale Health. Thank you for staying until the end. I hope you've had very inspiring day and good discussions at the round tables, and one more presentation to go. So we started with a story from Finland, and we end the day also from a story from Finland. So Nightingale Health is a preventative health company founded in Finland, but we operate globally. And we are focused on preventing chronic diseases, providing a technology for better prevention of chronic diseases. We have been focusing on that for the past 10 plus years or so, and the technology is in clinical use in Finland, in Japan, Singapore, US, and expanding to many, many more, which I will talk more at the later part of my presentation. So Nightingale, we are not a medical device manufacturer. We are not a laboratory providing licensed blood analysis, and we're not a software company providing the user interface for professionals, but we're all that. So we are a one-stop shop for prevention. And yes, so as said, we operate globally, and the challenge that we are dealing with. So I will start with the visionary part, and then move on to the very concrete, how we do it, and then present some use cases at the end of the presentation. So the challenge that we are committed to working with is nothing less than one of the most biggest challenge in healthcare, which is the chronic diseases. So with better prevention of chronic diseases, we want to bring better healthcare for everyone. So of course for each individual, for the individual, but also for healthcare providers and for health systems. And we started with this prevention topic a little bit with Jerome's great presentation. So currently we are in a situation that the healthcare, or should we say sick care costs, just keep on increasing. So we are very, very good at and very focused on the sick care side. And that leads to a situation that the costs are increasing, though the percentages vary a little bit, can be up to 18%, of course, domestic product. To give a little bit context, it's 4 times more than military spending. So the percentages can vary, or they do vary, but the ratio, it's pretty much the same. So it gives us the context. And of course, it's not only about costs, it's about the human suffering. So we are living in an era where we live longer than ever due to very important advancements on the sick care side. We live longer than ever, but at the same time, we are sicker than ever. So this is not a sustainable combination. So we have managed to extend the lifespan, but not the health span. We saw these numbers already earlier in Jerome's presentation. So the good thing is that 75% of deaths globally are caused by preventable diseases. So of course the diseases or the deaths are not a good thing. We're not in a good situation, but the good thing is that prevention is possible. These are diseases that are 80% of developing these diseases are impacted by our lifestyle. So we can prevent them. But still, we are in a situation where the costs keep on increasing, and they are expected to reach 47 trillion globally by 2030. So we know the problem. We know there's a solution. Why are we here? Why does the number of sick people keep increasing? And one of the core reasons is that able to do prevention in a way that impacts the big picture, you need to do it on a systemic level at scale. You need to be able to do it for entire populations. So we just have not had the tools to do prevention at scale. And I think during the talks today, one theme and some key words that I think were in every single presentation is that we have limited time and limited resources. So we cannot implement prevention by asking the system to do more, because it's already overloaded with its current tasks. So the solution for prevention needs to be something that saves time and saves money and can be integrated into the existing protocols in routine healthcare. So this is what Nightingale Health is focused on and where we have our solution. So when implementing this preventative system at large scale, we can lower costs, we have less suffering. So let's have a look in a bit more detail what this systemic prevention means. So everything starts from detecting the disease risks. And how Nightingale technology detects the disease risks, we do it from one blood sample. One blood sample that is collected routinely in healthcare. So this is why we save time and money and can scale, because we do it from blood. So I will use as an example estimating disease risk for cardiovascular disease. What you have to do with these risk scores that are now often used in healthcare, you have the patient come in, you will have an interview, you will ask about the family history. Well, you end up in a long discussion. Maybe my aunt had it, maybe not. You know, who remembers what they remember. You have to measure blood pressure. You have to have body weight measurements. So there's a lot of these manual steps that you need to do. So you simply don't have the time in routine healthcare to do all that. So what we do, we take one blood sample and we provide the disease risks in a scalable way. When you know the disease risks, you can target preventative actions to those in need and based on their individual risk profiles. So not just providing general advice or similar actions to everyone, but really tailoring the preventative actions according to the individual disease risks. And when you take the preventative actions, you have to be able to measure the outcome to create this system. And again, because we do it from blood, it's reliable, it's repeatable, and it's objective. So in comparing in my example of using, for example, questionnaires, or for example, using a tracking in app that the patient themselves put in, these are very subjective data points. So to be able to reliably measure the outcome of the preventative action, you need to have a tool that measures, did we manage to decrease the disease risks or not? And when you have this tool, funding can be directed. Now, if we're talking on a systemic level, funding investments can be targeted to there where the preventative actions have an outcome in lowering the disease risks. So let's compare a little bit of different ways of doing disease risk detection. So here we have, and now I'm referring to Tuomas' presentation in the morning, that the technology in healthcare, it needs to be easy and it needs to be right. So you want to have them both in order to have adoption in healthcare system. So we have these clinical risk calculators, which are good at detecting the risks, but they do it for one disease at a time. So for example, we have the CVD risk calculator. There's a lot of manual steps, so it takes a lot of time, and has the subjective data points, which decreases the reliability. Then, which is a very hot topic, of course, today, we have the AI risk models, which are highly automated. But as we also discussed in one of the roundtables, they are only as good as the input data is. So if you don't have the structured, good quality data, and especially in the context of disease risk detection, the molecular level medical data, they are very automated, but not that high in the quality. So this is what we do. We provide a solution that is both easy and reliable, because it is measured from a blood sample already collected routinely, and because it is reliable and automated because of that. So we don't need all those manual steps to have the disease risk information. So let's then have a look how this works in practice. A lot of fine words, but how do we actually do it? So as I said, we only need one single blood sample collected routinely, so nothing changes in the process how blood samples are collected in healthcare. What we provide is a clinical report of the disease risks. And this is, so I will, in the roundtable, I will have some example reports for you to go through and ask questions. So what we have in this report is all based on that one blood sample, and this is a demonstration of our capabilities. So of course the data that we provide can be integrated into existing reports, into existing platforms and systems to have a best solution for each healthcare provider, each healthcare system. So it's demonstrating what we can provide. And we start from this clinical summary in our report. So when talking about saving time, to make it concrete, so in order to detect disease risks for these diseases, you may need hours, but we give it to you in 30 seconds, the understanding of the risk profile. So the diseases for which we provide the risk detection are heart attack, stroke, type 2 diabetes, chronic kidney disease, and fatty liver disease. And we present the risk results in this very easy to understand traffic light model. So the science and the technology behind this can be very complex, but in order to take this into use in routine healthcare, the way how you show the results cannot take more than 30 seconds. It needs to be very simple and very easy to understand. So here we have an example. Patient, male, 60 years old, has a high risk for heart attack and stroke. So we can see it from here immediately. And so this works on individual level when going through the results of an individual patient, but this we can also provide in aggregated way for companies to see how your employees are doing, or for in public health for regions, for health system, to see how the nation is doing in terms of disease risks. So challenges in prevention, detecting the disease risks, and of course motivating people to take preventative actions. So that's also something that we have put a lot of effort in. How do we communicate that you are at risk in a way that is concrete and personal? So this is from an extract from our report with the same example patient. So this is the heart attack risk. So we show the heart attack risk is 18%. Well, that as a number may not say so much, but we show it in comparison to average risk for men at 60, which is 6%. So we can see the risk is very high. It's 3 times higher. But the good thing is, as I said, these are lifestyle diseases. Lifestyle impacts 80%. It's not about your genes. It's about the lifestyle. So you can do something about it. And it's very important to address the situation now. And that's why we show what happens over time. So when this patient is 75, the risk will be 49%, which means that every other person will get a heart attack. And again, we compare it to the average risk for men at 75, which is 17%. So we again get the comparison that this is a high risk in the real context. So after receiving the results of the risk assessment, preventative actions will be agreed with the doctor, and then a follow-up measurement will be set depending on the risk profile. It can be after 3 months, after 6 months, 1 year, depending what kind of risks for chronic diseases we could detect. And again, we show in a very easy to understand, simple way, the progress over time. So the goal is, of course, to get them to the green level. And this is very motivating when you can see the results of your actions. This is also one use case is for medications. If that's the approach, sometimes there's no impact that we can feel or detect. So there may be difficulties to get the patient stick to the medications. But here we can also motivate, even though nothing changed in your life, directly you see that the disease risks are lower. So to summarize this way of doing prevention, we detect the disease risks from a single blood sample. Preventative actions are targeted, and then they are measured in a reliable, repeatable way. So like Tuomo said very well, that there's a lot of these different kind of applications that are being provided in the already overwhelming amount of information, but there needs to be something that connects all those tools and information, and this is what you can do with our technology. So you can measure if you decide to take a new technology into use in some lifestyle guidance, prevention, well-being app. How do you know if it was worth the investment? How can you see the outcome? So that's often has been the missing piece, which we provide. And there's also a health economics study proving my point. So very recently published study modeling this into the future, how much time and money we can save if we start using this risk assessment based on the metabolic profiling what we do. So these are concrete numbers: 200,000 hours and from 26 million to almost 300 million. And this study was only done for looking at CVD prevention. So now you saw that we have the chronic diseases very comprehensively. So the cost savings that we can achieve by adopting the full Nightingale panel are even much larger. So this is a study looking into the future, but this is not just a vision how this technology is used. It is actually being used widely. But before going into the clinical use cases, I just want to mention our roots in the medical research. So that's where we started, and we continue providing our services to large biobanks and other medical research institutions globally. So we serve more than 30 countries, and there's already more than 600 scientific publications published using our technology, and more than 2 million samples analyzed in total. So moving from this science and research to the clinical use cases. So starting from Finland, and I hope you were here in the morning to hear Tuomas' great talk. So we work together with Terveystalo. And as Tuomo mentioned, the Finnish healthcare market is very consolidated. And Terveystalo is the leading provider. So in this collaboration, we implemented the Nightingale disease risk assessments into routine occupational checkups. And because of this consolidated market, this covers approximately 1/3 of the Finnish working age population. So how it was done? Our risk assessments replaced the more manual ways of assessing the risk. So now when the customer, the occupational health customer, comes to see the nurse already has the disease risk report at hand. So the time when meeting the professional can be used to agreeing the next steps, to discussing about the lifestyle, to use in the core work, rather than measuring blood pressure and trying to understand the disease risk. So we take that work completely away and allocate the time to work that produces more value. We are very happy with this collaboration and have also received very good feedback. In addition to private sector, we work with the public sector in Finland. So there is first, as a pilot, we will start providing the Nightingale disease risk assessments to a population of more than 100,000 people. And again, bringing this into the routine testing. So, for example, instead of taking just a cholesterol test, we also provide those standard blood values with our technology, but we also provide the disease risk assessment from every sample. So this project will then follow up the impact on individual level, of course, but on the level of this regional public healthcare entity. So they will be dividing people into different treatment pathways with our technology, try different preventative programs, and then measure what worked. And this will start very soon in early next year. And in addition to Finland, we have clinical customers in Japan. So we are part of the Japanese annual health check system in more than 300 clinics across Japan. In Southeast Asia, we have a laboratory in Singapore, together with one of the leading diagnostic service providers, Pathology Asia. So starting from Singapore, expanding to other countries in Southeast Asia. And then in the US, we also have several partnership often starting from the research and then combining this integrated model of research, insurance and care. So I started from the vision, and I want to end with a visionary statement. So together with these partners that I mentioned and many, many more to come, we are creating better healthcare for everyone. So for individuals, for healthcare providers, and for governments, for nations. So thank you. And as said, I will be in the roundtable answering any questions, if you want to understand in more detail, how do we do this, and I will bring some reports for you to see as well. Thank you.